Okay, so today I'd like to talk to you about reflux, acid reflux, and surgery for acid reflux. So we've been performing a lot of cases where patients have, gastroesophageal reflux, which means heartburn or acid indigestion, as they call it, or acid coming up. And patients, many of them have been on proton pump inhibitors, which is things like omeprazole and Prilosec. What these medicines do is they suppress the acid, but patients are still regurgitating. That means liquid is still coming up. And that's not an innocuous thing. That liquid that comes up, it goes into the lungs and it causes lots of problems. Some people get pneumonias from it, they get recurrent bronchitis from it. And then a lot of patients think they have asthma, but in fact, it's the acid reflux that's causing irritation. And just staying on those medicines like proton pump inhibitors for the rest of your life is not a good enough solution because they're still regurgitating. So we believe this is a mechanical problem and it needs a mechanical solution. There's a valve at the end of the esophagus or the food tube, and that valve is supposed to prevent the acid from coming up. And patients who have a hiatal hernia, that valve cannot work. And then there are patients who don't have a hiatal hernia, but still that valve is not as effective. The pressure over there, we call it the lower esophageal sphincter. The pressure there is low or not strong enough to prevent the acid from coming up. So we treat this mechanical problem with laparoscopic procedure, that means done with the small incisions. And nowadays I do these mainly robotic. And there are 2-3 different things we could do. There's something called fundoplication, where we wrap the fundus of the stomach, which is part of the stomach, around the lower part of the esophagus to create a valve. So then you don't need these medicines for the rest of your life, some of which have side effects like osteoporosis and other things. And even when they don't cause side effects, they still allow continuation of acid regurgitation, or not necessarily acid, but liquid regurgitation. So when we do these procedures, we do them with the small incisions. They're about 4 tiny incisions. Procedure takes about half an hour, maybe 45 minutes. And you, in more than 95 to 98% of patients, they don't need to continue taking these medicines. So they're freed from this for the rest of their life. And plus, they're not regurgitating. There's also a procedure called the Lynx procedure, where we place these magnetic beads around the esophagus, and that helps to control acid reflux as well. So if you're having acid reflux, which is persistent, then you don't necessarily have to stay on these medications for the rest of your life. There is an alternative, and the alternative is having this minimally invasive procedure where we can do these with the tiny incisions. We can either do it just laparoscopic or laparoscopic and robotic, and then we can cure this problem for you. So I look forward to seeing you if you have this problem.